In an 18-year time frame, 62 state psychiatric hospitals permanently closed their doors.
The closing of these resources can result in former patients and people without proper care resulting to crime, falling into homelessness, or worse yet, even committing suicide.
The patients that weren't deinstitutionalized were pushed into other facilities with limited number of beds, which caused overcrowding.
This led to an overall negative impact on communities, as mentally ill individuals were removed from inpatient care centers and placed in situations where they did not have access to proper care. Without the care that they needed, many of these people became homeless, as they were not able to care for themselves and their families were not able to provide care for them either.
These closures also coincided with the beginning of a homelessness crisis and were certainly a factor, as the government did not provide the proper care for these people after sending them away from the closed hospitals.
In fact, without adequate mental health support, many individuals who are homeless may end up committing crimes, leading to incarceration. Now, the people who pushed for deinstitutionalization claimed that it was needed to prevent the abuse of mentally ill patients at hospitals. And while this was an issue in some cases, a better solution would have been to provide better training to workers at mental health facilities, along with increased oversight.
When people don't have access to mental health care, it affects everyone, including those who aren't struggling with mental health issues, such as those in the justice system. Without the proper care, these people often end up getting incarcerated. Sadly, they are sent to prison due to a lack of mental hospitals.
Incarceration rates are much higher in those who are mentally ill. This leads to issues in prisons, such as overcrowding. The majority of prison staff are also not trained to handle mentally ill individuals, which could lead to possible cases of abuse and mistreatment, which is exactly what they're trying to prevent from happening.
These conditions can make people more likely to be a danger to themselves or others.
In fact, according to an article from the National Library of Medicine, the length of time spent in emergency rooms for patients who attempted suicide increased after the closure of inpatient mental health facilities in the region.
One example of a mental hospital closure was Searcy Hospital, an inpatient mental health hospital that was open from 1920 to 2012 and was located in Mount Vernon, Alabama.
It was closed as a part of a large trend towards deinstitutionalization that has been happening since the 1970s.
The closure of Searcy caused all of the patients to be either relocated or released, which left them without proper care and put them in a situation where they could be a danger to themselves or others. In fact, the rate of suicides in Alabama increased in 2012, the same year as the closure.
The closure also hurt the community economically. A large portion of the community was inhabited by employees of the hospital who were left unemployed by the closure, and many of them ended up leaving the community to find work elsewhere. As you can imagine, this was very bad for the community at the time.
The closure also led to many buildings being abandoned, along with the hospital itself. Essentially, the closure led to a large amount of abandoned infrastructure.
All of the people who were patients in the hospital had to leave too, along with the closure.
So who is responsible for taking care of these people now that they were no longer in long-term mental health facilities?
Well, a lot of these people were sent to some of the few other hospitals that were left, or diverted from inpatient care to community services. But outpatient care was simply not effective for some of these former patients. The outpatient community services were also very underfunded.
Now let's take a look at how these negative outcomes could have been avoided or at least partially prevented.
Well, one thing that would have helped would be if the government diverted some of the money saved by closing the hospitals into providing funds for homeless shelters to help the mentally ill former patients who weren't able to afford a home or didn't have family or others to take them in.
Steps also could have been taken to provide more funds to the community health centers, along with hotlines established for those who are in serious danger in moments of crisis.
In conclusion, all of these issues combined are effects of the failure of government and communities to protect the right to health and well-being of the mentally ill.